going to be walking into the room with my mask and my face shield on. I'm going to perform hand hygiene for 20 seconds. Hi, I'm Christian. I'll be your nurse for today. I know you're having a hard time talking right now, so I'm going to set up a form of nonverbal communication. Alright, are you able to give me a thumbs up for yes and a thumbs down for no? Alright, and is your name Carcacino and your birthday is September 25th, 1998? Okay, and do you have, I'm going to check your wristband. Everything matches up. And do you have any allergies I should be aware of, such as tape or latex? Okay, sounds good. So today I'm going to be performing trach care for you. Have you had this procedure done before? No? Well, I'm happy to explain. So first I'll be removing any secretions you may have by suctioning it. Then I will replace your inner cannula with a new one. It's that tube that goes into your tracheostomy. From there, I will clean around the site and apply a new dressing. And I will finish it off by calling in my friend to help me change out your trach stabilizer around your neck, which is helping to stabilize everything. Do you have any questions or concerns before I begin? Okay, perfect. I'm going to perform hand hygiene for 20 seconds. And have you been experiencing any pain lately? Okay, and then do you have any shortness of breath? Alright, so I'm just going to take a moment to look at your vital signs. Most of your vital signs are within normal limit, but your respiratory rate does seem a bit high at 28, and your oxygen saturations are low at 90%, but this will increase once I am done removing your secretions. So now I'm just going to take a moment to listen to your lungs. I'm going to be listening to 4 different spots. I just want you to take a deep breath in as I move my stethoscope, and then breathe out. Breathe in. Breathe in. Breathe in. Breathe in. Okay, so I am hearing some gurgling sounds, which means there are secretions present. So once I remove those, you'll be breathing a lot easier and a lot better. I'm going to be performing hand hygiene for 20 seconds. So just give me a moment, Mr. Aquino, as I wipe down my table for 30 seconds and let it air dry for 2 minutes. I hope you're doing well, Mr. Aquino. I know you've been keeping it with the news lately, ever since you were admitted. I'm also going to make sure to clean around the edges of the table. Okay. I'll perform hand hygiene for 20 seconds. So once again, I will let my table air dry for 2 minutes. At this point, I will close the door, close the curtain to ensure patient privacy. You are already in semi-Fowler's position, which is needed for this procedure. I'll also take this time to check my emergency bedside equipment. I have 2 trachs. One is a size 6, one is a size 8, which is your size. And then I have I have another one which is a size 6, which is a size 6, which is the smaller size. I also have an extra inner cannula, and then I have my ambu bag, which I will turn up to 20 liters of oxygen. So now it is connected to 100% oxygen, and it is working well. I also have my suction catheter, which I will now be replacing because I don't know when it was last changed. Going to perform hand hygiene for 20 seconds. Now that my table is air dried, I'm going to bring in my equipment. So I have my saline water, my inner cannula, my trach stabilizer, and my trach kit. So I will be placing this drape on you, Mr. Smith. And then I'm just going to be pulling it a bit down. All right. I'm going to be dropping in my inner cannula. And then pouring in some saline water into the cube and into my kit. I'm going to be performing hand hygiene for 20 seconds. And now I can begin suctioning you, but before I do that, I'm going to make sure to hyperoxygenate you. I'm going to give you 2 to 3 breaths and wait 6 seconds in between before I do so, just so I can raise your oxygen saturation level. Right? 1, 2, 3. All right. So how is that for you? So it looks like your oxygen saturation level has gone up to 98%, or 98%, which means I can begin suctioning you. I am just going to test out my suction catheter by first suctioning some saline water. All right, it looks good. So I can now insert it in 3, 2, 1. All right, how was that? Did you experience any pain? Okay, well, it looks like you're breathing a lot better now. You're no longer using your accessory muscles. Your respiratory rate is also gone back down to 16%, and your oxygen saturation level has stayed at 98%. Do you require any more suctioning? Okay, good. Well, if you did require any more suctioning, I would make sure to wait 30 seconds before I make another pass with my suction catheter, making sure to hyperoxygenate you before doing so if needed. So I will put your oxygen collar back on for a moment. I will perform hand hygiene for 20 seconds. All right, I will now remove your inner cannula. I'm just going to take off your oxygen collar, and then I'm going to move your drape back up. Okay. I will now remove your inner cannula. And then put in the new one. Okay, how was that? Okay, good. Looks like your respiratory rate is still at 16 and your oxygen saturations are still at 98%, so that is very good. But I would put on the oxygen collar. You still need it. I'll also remove the dressing from underneath. And then I will just take a moment to assess the site. So there is no signs of redness or swelling. There's no signs of infection or any signs of skin breakdown. Your trach, your trach is still intact. There are no cracks, and your trach stabilizer is also intact. But I will be removing that shortly. So now I'm just going to put my alcohol swabs and my gauze into the saline. All right. I'm going to now clean your site. I'm also going to make sure to clean the face plate and then dry it off. And I will also replace it with a new dressing. Okay, how was that for you? Any pain? Alright, very good. Your respirations are still 16 and your oxygen saturation still 98%. So I'm just going to put your bed in the lowest position, 2 to 3 side rails up, put your collarbone within reach. I will be back in just a moment to bring my friend. I'm going to perform hand hygiene for 20 seconds. Hi, Mr. Aquino, so I have a turn with my colleague. She's going to help me replace your trach stabilizer. We're going to perform hand hygiene for 20 seconds. I'm just going to remove your oxygen collar. So I see no signs of redness, swelling, or any signs of skin breakdown or infection on your neck. Do you see any signs of redness, swelling, skin infection, or any skin breakdown?
No.
Okay, perfect. And I'm just going to test it out by putting 2 fingers underneath to make sure it's not too tight or too loose. So it looks good. Just going to put your oxygen collar back on. Going to remove our gloves and perform hand hygiene for 20 seconds. My colleague can now leave. So how's that for you, Mr. Aquino? Any pain? Okay, perfect. Alright, so I'm just going to take a moment to look at your vital signs. Your vital signs are within defined limits. Your respiratory rate is still at 16 and your oxygen saturation is still at 98%. So I'm just going to take a moment to listen to your lung sounds. Make sure you breathe in and then breathe out every time I move my stethoscope. Breathe in, breathe in, breathe in, breathe in. Okay, so your lung sounds clear. Do you have any shortness of breath or any pain right now? Okay, sounds good. And how was this procedure for you? How did you tolerate it? Well, okay, very good. So I'm just going to make sure I have all of my emergency bedside equipment. So I have the 2 trachs, one is size 8, which is your size, one is size 6, which is a size smaller. I have an extra inner cannula. I have an ambu bag connected to 100% oxygen, which is working, and I have a clean suction catheter in place. I'm just going to take this moment to dispose of all of my equipment. And then do you have any questions or concerns for me before I leave? Okay, sounds good. Just going to make sure to put your bed in the lowest position, your collarbone within reach, and your 2 to 3 side rails up. Make sure you hit your collarbone if you need any assistance. I'm going to perform hand hygiene for 20 seconds and leave the room. So now I'm going to document the date and time of the procedure. The patient experienced no pain and was tolerable to the procedure. The periosteal site had no signs of redness, swelling, or any signs of skin breakdown or infection. Their sputum was clear and thick with water-red amounts. Their lung sounds were gurgling. Their lungs were had gurgling sounds before the suction and are now clear after suctioning. Their vital signs are also within defined limits. Their respiratory rate was 28 before suctioning, but now is at a 16 after suctioning. And the oxygen saturation before suctioning was 90%, but has now risen to 98% after suctioning as well. Thank you.